We begin with breaking news from India, where at least 22 patients have died at a public hospital in India's western Maharashtra state when their oxygen supply ran out after a leak in the tank. That hospital has been treating coronavirus patients. Elizabeth Puranam is joining us from New Delhi. Elizabeth, what can you tell us about this incident?
Hello, Dareen. So we are hearing that there was a leak in an oxygen tanker in a hospital in the city of Nashik in Maharashtra, that this happened as the tanker was being filled. The hospital said that it was able to stop the leak, but the health minister said that while doing so, that affected the oxygen supply for the people in the hospital, resulting in 22 deaths of COVID-19 patients. Now, the hospital also said that they tried very hard to save lives after this incident. The initial number of dead was 11, but that soon went up to 22. Now, unfortunately, accidents in hospitals aren't uncommon in India. There have been a number of fires over the past year, resulting in the deaths of COVID-19 patients in hospitals. But this is also happening as many states in India are seeing an acute shortage of oxygen supply. Here in the capital, Delhi, we've had Delhi's leaders pleading with the central government to provide oxygen for hospitals, which have said that they're going to run out in a matter of hours. One of Delhi's biggest private hospitals, which received oxygen on Tuesday night after raising the alarm about the shortages, told us that they have received oxygen, but now they only have enough supply to last them until Thursday morning. Elsewhere in the country, we are seeing many reports of people dying because they haven't been able to get oxygen. And we've had on Wednesday reports, it's come to light rather, that India exported double the amount of oxygen in the past year than the previous year, and it's now in a situation where it's having to import oxygen because of the shortages as more and more people are hospitalized with the huge rise in cases that we're currently seeing.
And Elizabeth, what is the response from the central government to all of this, and have they said anything about this latest incident?
So this has just happened about an hour ago. We haven't heard from the central government, but local authorities in Maharashtra have said that they are going to investigate what happened and hold whoever is responsible to account. This is what we hear after other accidents, including those at hospitals. We heard from Prime Minister Narendra Modi about what is happening in the country. He addressed the nation on Tuesday, and he said that India is facing a storm, but that a lockdown has to be the absolute last resort. But despite him saying that, we're seeing many restrictions come into place in many other parts of the country. Delhi, where we are, has very strict restrictions. They're calling it a curfew, but it is all the same conditions as during the nationwide lockdown last year, where people aren't allowed to leave their home unless it's for essential supplies, to get essential supplies, or if they work in essential services. The worst affected state, Maharashtra, where the incident with the oxygen tanker leakage happened, they are considering a complete lockdown, putting 120 million of its people under a complete lockdown. Maharashtra is going to decide about that on Wednesday. But for now, the government and Prime Minister Narendra Modi, they're asking people to do their bit to stay indoors as much as possible, but ruling out a nationwide lockdown to deal with this second wave.
And Elizabeth, as well as the health system buckling, as you're describing, we also hear that crematoriums are struggling to cope.
Around the country, we have crematoriums and burial grounds working day and night. We're seeing pictures of dead bodies piling up outside of hospitals because freezers are full. In India, funerals are held very, very soon after deaths, and that is because of the very warm temperature, because of a shortage of freezing facilities. But families of victims are having to wait for a very long time. People are being cremated outside of assigned cremation grounds. The state of Karnataka has ordered public ground be made available because of the rise in cremations. We have reports in the state of Gujarat where crematoriums have been working for so long without a break that metal parts in furnaces are starting to melt. And also in the state of Gujarat and also in Madhya Pradesh, there are many reports, especially from local media, where the official death toll does not add up, is nowhere near the number of COVID-19 patients who are dying in hospitals and the number of COVID-19 patients who are being cremated or buried.
Okay, a very worrying situation for the time being. Elizabeth, thank you so much for that update from New Delhi. Well, Anand Ban is a physician specializing in bioethics and global health policy, and he told us earlier the government has failed to prepare by enhancing oxygen supplies after the first COVID-19 wave in India ended last year.
I think, when oxygen supply was planned last year, this was probably keeping in mind the local demand. The local demand has really peaked over the last few weeks, and I think what we are seeing now is perhaps not enough forecasting of that kind of a need. We have an acute situation right now in many states, and that also means that within the country there is an inability to be able to provide oxygen to areas because almost every state is now clamoring for more supply. We went through almost 2 to 3 months of cases going down. We had a lucky break in that sense. But given global experience, I think there was always the chance that we would again see a resurgence. And the resurgence this year has been much more sharper than last year. So unfortunately, it seems to be the case that the lessons from last year perhaps were not registered adequately. The recognition that those who need admission certainly need oxygen, and if the number of cases who were admitted would increase exponentially as we are seeing right now, that there would be a possibility of shortage of oxygen. This would have been something that policymakers and health systems officials should have thought through. Unfortunately, it seems to be the case that not enough was done in advance, and now we are again in a situation where it's almost on a day-to-day basis that planning for oxygen supply is being done. There is a lot of reluctance to go down either with a national lockdown or statewide lockdown. That having been said, many governments have already started that process. They might not call it a lockdown, they sometimes call it a curfew, etc. But there is a recognition that there is a huge amount of strain on the health system in many parts of India, and we need to bring down the number of cases, otherwise it could reach breaking point.